Hi everyone, my name is Taylor Kreis, and for my educational outreach project, I decided to do it on cesarean deliveries, which is more commonly known as C-sections. Okay, so now on to the general information. C-sections are surgical procedures used for women that are unable to give birth vaginally. Due to some health issues, either from the mother or the fetus, C-sections may be the safest option, like when the placenta, which is the sac that houses the baby when it's in the mother's womb, is low enough to cover the cervix, or when the baby loses oxygen or is in distress. Sometimes C-sections are planned out in advance, especially for women who have previously had a C-section before. If a woman has had a C-section before, she will most likely have a C-section if she wants to have more kids. C-sections are a fairly quick procedure, on average lasting about 30 minutes. To start the process of a cesarean delivery, women are given an epidural or a spinal block, which numbs the lower half of the body, so that once the baby is born, the mothers are awake and capable of holding the infant. An anesthesiologist will insert the epidural catheter in the lower back into the area just outside the membrane, covering the spinal cord, called the epidural space. Women can either sit up or lay on their side with their back rounded, as you will feel a little pressure while the epidural is inserted. A catheter will also be placed into the bladder to collect urine during the procedure. Once the mother is numbed, the obstetrician or the physician performing the procedure will make two small incisions, one in the lower abdomen and the other in the lower part of the uterus. There are two types of incisions. First is the low transverse incision, which is the most common. Since the muscles at the bottom of the uterus are thin, this incision results in less bleeding and is less likely to tear during other possible vaginal deliveries. The second incision is the vertical cut incision, which cuts down the middle of one's uterus, and it is usually only required if the fetus is in an unusual position. The image to the right shows the incision types. The one on the left is the low transverse incision, and the one on the right is a vertical cut incision. After an incision has been made, the amniotic fluid will be suctioned out. Once the baby is out of the womb, don't be alarmed if the baby doesn't cry at first. Since it didn't go through the birth canal, some extra suctioning will be needed to clear the lungs. The baby will then be placed directly on the mother's chest for skin-to-skin contact, which is shown to stabilize the baby's heart rate. The operating physician will then cut the umbilical cord, which is shown in the picture to the right. They will then remove the placenta and quickly check your reproductive organs to ensure that nothing else was damaged. Mothers will have absorbable stitches in their uterus and on their lower abdomen, meaning that they won't need to be removed at a later date. Here's a video to give you a better visual aid of what a C-section really looks like.
Patient will be awake and a regional anesthesia will be used. This form of anesthesia will numb the patient from the waist down. However, they will still be able to feel some tugging and pulling during the operation. A urinary catheter will be placed to help drain urine from your bladder during the surgery and will remain in place until after the surgery. During pregnancy, and especially during a cesarean section, a mother is at an increased risk of deep vein thrombosis. Therefore, it is likely that compression boots will be used and remain in place throughout the surgery. The surgical team will then clean and place surgical drapes on the patient's abdomen, and a screen will be placed at the level of the chest to separate the patient from the open surgery. Before cutting the first incision, the surgeon will check that the anesthesia is working and the patient is sufficiently numb by confirming no pain is felt. An abdominal incision is made into the abdomen. Usually, this incision is made along the bikini line to help hide the scar. However, sometimes a midline or slightly higher incision may be required. The layers of the abdominal wall are opened and extended to allow room for delivery of the baby. The patient may be aware of a tugging sensation, but it should not be painful. A retractor is placed in the inferior aspect of the incision to hold the bladder out of the way and to protect it. The surgeon will then cut an incision into the lower segment of the uterus. The amniotic sac is then opened and the surgeon will now be able to deliver the baby. If If the baby is born in good condition and the surgical team have no concerns, delayed cord clamping can be implemented to maximize the oxygenated blood that reaches the baby. The baby can then be checked by the midwife or pediatrician. Skin-to-skin contact can be supported in the operating theater if the mother chooses. The placenta will then be delivered and checked. It may take longer to recover after a cesarean section than a vaginal birth. If both mother and baby are doing well, they can normally go home the following day and continue to receive care and support from their midwife and GP.